Hello and welcome to Clinical Conversations on today's Smart Chiropractor show. We've been revisiting some of the presentations from Axis 2021. That was our clinical online event. And yes, we're going to keep encouraging you. Stay tuned for details around Axis 2022 coming up very, very shortly. But today we're going to play a brief presentation, part of what Dr. Kevin Christie presented, which is treating and working with rotational athletes. We presented a little bit a few weeks ago around the concepts of how you use this when you reach out in your community. Today, we wanted to share a 10-minute clip where he dives into some of the specific exercise protocols, movement assessments, and more that he utilizes in his personal practice in South Florida when treating rotational athletes. So let's take a look at Axis 2021, Treating Rotational Athletes with Dr. Kevin Christie.
Today, I'm going to be talking about golf and the shoulder and trunk connection. We're going to talk about a lot of different things that relate from all the way to the hips to the shoulders. I understand that the foot, ankle, and the knee and the elbow and all that stuff plays a part of it. To be concise, we're going to dive into those areas. This particular video is going to be broken down into a few different sections. We're going to talk through this a bit, and then we're going to go into some functional testing that you can do in your office. Then we're going to go into some swing faults that you could look at on video to really try to help make that connection between the swing mechanics and the injury and your treatment plan. And then we'll wrap it up with some more information. Right out of the gates, I want you to understand that this is going to be a lot of TPI stuff, but at the same time, there's going to be other aspects of it. And being a MPI doc really gives you a leg up compared to other therapists that are doing the TPI screen. Level 1 TPI is a lot of different types of fitness people, golfers, doctors, but having your skill set is going to be able to really make a difference for golfers in your community. And the good thing is no matter where you live, golf is probably being played. It might be seasonal. Down here it's year round, but it might be seasonal, and it's a really good target audience for you. And I'll talk a little bit towards the end on how you can kind of network in that and grow your practice for golfers as well. But the majority of this is going to actually be clinically related. And I look back at one of the questions that was asked at a TPI level 2. So I'm TPI certified through level 3, and even back in the day, they had a golf biomechanics class, which I really enjoyed, and that was a lot of 3D analysis. But a question was posed to Dr. Greg Rose about how come in TPI there's no treatment methods taught? And it was a good answer that he gave. Essentially, he can't expect to be able to teach chiropractors how to do manipulation, how physical therapists to do this, that, and the other things. So they try to teach you how to assess, understand golf injuries, the video aspect of it, and then you apply your treatment skill set to that. And that's going to be the same thing for this video as well. You're going to have a different skill set than maybe your colleague, but if you can understand how to assess golf injuries, you can apply your manual skill set and your treatment to that. So I'm not going to dive into a lot of that. I will make reference to where some good motion palpation and manipulation will be beneficial and give you a leg up to other folks. But we're going to really just go into screenings, assessments, and some correctives, okay? One of the things I want to touch on that gets a little bit confusing, but is it's very instrumental in understanding how the body works during golf, and that is the 3D kinematics, or the kinematics of the golf swing that TPI teaches. And it's really understanding the pelvis, torso, shoulder, and arm. Okay, so in that, you have to understand that the pelvis needs to start the golf swing, and then the torso follows, then the shoulder and the arm. And so some of the questions I'll ask a golfer when they're a patient of mine is things like their handicap, because you're not going to be able to get their 3D analysis most likely, unless you're working with some really high-level golfers. It's really difficult to get that. Now, I was fortunate enough for a few years to be working with Florida International University, and I had the whole setup. I was on the research, so I've done a lot in this regard for the 3D analysis. But I just want you to know that this is going to be kind of the blueprint of someone's swing. It doesn't matter what their backswing looks like. It doesn't matter what they look like. If they have a really good 3D kinematics of the swing, they're going to have really good power development, and they're going to prevent injury. Because what ends up happening, and I'm going to show some of the swing faults there, is if you get into this golf swing here, you'll see a lot of golfers from here will start to swing with the upper body, and that's going to cause a lot of shoulder issues, and you're going to deal with that tug of war battle all the time between you treating them and them going onto the golf course and not getting the results that you want. They're going to re-injure themselves. So really what you want is from here, you want the pelvis to start to swing, then the torso is going to come through, and then the arms come through last. And so when you watch a really good golfer, that pelvis is already rotated quite a bit. And it's kind of that whip analogy you'll hear is the energy is going to transfer from the lower body out to the club and really generate a lot of good power without putting stress. So the arms and the shoulders really should just follow. And so understand that kinematic sequence is going to be important in the golfer. And so many mid-handicap or high-handicap golfers, they're out of sequence somewhere, right? They may start it with the torso, and then the pelvis goes, and then the shoulders. They may start it with the arms. That's very common in high handicappers. So I like to ask those questions of the golfer and just say, okay, what's your handicap? How often are you playing golf? Do you have a teaching professional you're working with, which is going to be part of what I talk about later on connecting with golf pros as well. But you want to start understanding where this golfer's probably talent level is. And then if they have video of your swing, with technology now is great. You can get that video. We use Spark Motion to assess when we need to, but there's a lot of different things out there where you can assess the video. And I'll go over some key things to look for when it comes to the trunk and the shoulder when we go through them, okay? The thing that I really find exciting about working with golfers is a lot of times you're trying to put this puzzle piece together. And so you might have a golfer with shoulder pain or shoulder injury, but it could be because of the low back or the pelvis. Or vice versa. You could have a golfer that's got a lumbopelvic issue and pain, and that's what they're coming to you for, but it really could be a shoulder issue. So we're going to figure out how that works and show you some things to really work through that in today's video. So just to kind of summarize what we're going to go through, we're going to show you how to assess the pelvic mechanics. You can obviously add some motion palpation to that and adjustment, and then we're going to work our way up from probably the hip joints all the way up through the shoulder into the elbow a little bit, and then understand, yes, foot and ankle and all the other parts of the body play a role in it, but for brevity, we're going to handle those areas and try to give you an understanding of how the body's working in golf, and then you can apply your other assessments and treatments to that golfer. Typically in my office, I will run through a SFMA to get a general screen going, but if it's a golfer, I'm going to then dive into some golf-specific testing. Before I do that, I will run through evaluation of the hip joint, and I'll do other things too, but for the sake of this presentation, I'm going to check the internal and external rotation of the hip joint. I don't need to show you that. You know how to do it. But with golf, you really want to make sure you get about 40-45 degrees of hip internal rotation, and at least 55-60 degrees of hip external rotation. It's going to be really important for the golf swing, because if they can't internally rotate that right hip on a right-handed golfer, it's going to set up for a whole lot of other issues. Now, if you think there's significant arthritis and degeneration in there, that's something I'll let you handle clinically, but we want to have good range of motion of the hip joints. Without that, it's going to be really difficult for the low back, and then that's going to work its way up to the shoulder. For here, we're going to try to figure out the pelvic mechanics. I mentioned that kinematic sequence, that you really need that pelvis to function. And what's interesting about that, they've done a lot of analysis of it, and the pelvis is going to do quite a few things during the swing. So if this golfer is facing that way and it's a right-handed golfer, and this is their pelvis, they're going to be set up in a little bit of an anterior pelvic tilt. But as they as they go into their backswing like that, they're actually going to go into even more of an anterior pelvic tilt. So there's going to be some tilting anterior of the pelvis. But then as that pelvis starts to rotate towards the target, there's going to be an ab crunch in a sense, and it's going to posterior pelvic tilt as it's rotating there. And so if that golfer can't do that smoothly, it's going to chew up the low back and cause all kinds of other issues from a performance standpoint as well. So these three tests that we're going to go through right now are going to help us see how fluid that is, and it's also going to allow us to see how their X factor or X factor stretch is. And so I was fortunate enough years ago to do a little bit of work with Jim McLean down in South Florida. He's located down here, and my office was down there. And he came up with that term, the X factor, and then subsequently other people called it the X factor stretch. The X factor is just the difference between the rotation of the pelvis and the torso. And so they really want to get about 45 degrees of the pelvis and 90 of the shoulder, and so that difference would be 45 degrees, right? 90 minus 45.
Great presentation from Dr. Kevin Christie at Axis 2021. We know a lot of people viewing, they geek out on the clinical stuff. So we're excited to bring Axis 2022 back this summer. Keep your eyes peeled for it. It's going to be awesome. And 2021 was really fantastic. So if this is the first you are hearing about it, please check out some previous episodes of this show. We've been highlighting Axis 2021 presentations since the beginning of this year, getting you not only pumped up for 2022, but instilling that knowledge from the experts that we were able to highlight this past year. Jason, takeaways from Kevin or on Axis?
What a great event. Axis, of course, is C2, the second cervical, and C2 is clinical conversations, just to make sure everybody's getting the connections there. Kevin's terrific. And, so is, as he references, Greg Rose and the ability to work with people on the things that are important to them. And that's one of the things I just love about what we can collectively do as chiropractors is, celebrate our diversity, celebrate the fact that we're not all the same thing, saying the same thing to everyone, doing the same thing in our practices, but we have a spectrum of ways we can serve a spectrum of different people. And if you love sports and you love working with athletes, and if you love specific sports like golf, this is a really great way to be able to both find your joy and passion in what you're doing and connect with other people that are probably also joyful and passionate. Golfers oftentimes are very frustrated, but find and share and maybe even limit your frustrations because you're able to improve the mechanics of the body, maybe even the mind if you start going there as well, and helping people live the life that they want to. Kevin's a great dude. The event is terrific. Keep your eyes open for Axis 2022 coming up. Great choice, Jeff.
Well said. And if you know Kevin, shoot him a message. Let him know you saw him on the Smart Chiropractor show. Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.